member of IFS. And we have with us Dr. Mamta. She is the Joint Secretary of IFS Rajasthan chapter. And we both will be the coordinators for today's quiz. And we have with us Mr. Shivam at the backend, who will help us to conduct this quiz in a smooth manner. So I hope you all must have downloaded the Zoom and the Kahoot app. And it is better if you use two separate devices for the Kahoot and the Zoom so that it is easy for you to answer the questions. So some of the general instructions are, once we have sufficient number of participants, we will start the quiz. And your Kahoot pin will be shared on this platform. Then you have to enter that pin and start the Kahoot app, the quiz. So once you start the Kahoot, you will have to enter your mobile number in the place where your nickname is asked. So no fresh entries will be allowed once we start the quiz. And there will be 20 questions, and all the questions will be multiple choice questions. And you have to select the correct answer out of these. And 20 seconds will be given for each question. But the speed and the accuracy of the answers will be your criteria for the scores, for your scores. And these scores, this faster you answer the questions, the higher scores you will have. So once we move to the next question, you cannot attempt the last question. I will read the questions for you. And we'll have, at the end of the quiz, we'll have 3 winners who will get the chance to participate in the next round. We'll have 2 runner-ups also. So if you have not downloaded the Kahoot app yet, please download the app. And in next few, we'll wait for a few more minutes for the next participants to join, and then we'll start the quiz. Anything else, Dr. Mamta, you want to add?
None. No, nothing. We can start after 5 minutes, I think. 4:07 is
Yeah.
already. We can start on
Yeah.
4:50.
4:15.
In the meanwhile, we can share the Kahoot pin, ma'am, here, right? So every participant can join. Oh, you can see my screen, right? And 10 participants have joined. One participant have joined. So are we waiting for some more?
We can wait for 2 to 3 minutes more.
Okay, done, ma'am.
Is there any problem in joining Kahoot to the participants?
Should we wait for some more time, Dr. Mamta, or should we start?
I think we can start. It is already 4:15.
Okay. So once
Is there
again,
any-
yeah.
I just want to ask participant if they are feeling any problem in downloading or joining in Kahoot app, then we can wait for them.
I think we are having around 13 participants.
Yes.
So I'll
Actually,
read the
24
instructions.
participants have joined Zoom link, but only 14 participants have gone on Kahoot app.
I think they might be having some problem.
Yeah.
So meanwhile, I'll read the instructions once more.
Yes.
So once we will start this quiz, you will be given the Kahoot pin. You have to enter the Kahoot pin on your app, and then in the column where the nickname is asked, you have to enter your mobile number. Then the questions will be displayed on your screen one by one. The questions will be read by me, and you will be given 20 seconds to answer each question. These questions will be multiple choice questions, and you have to mark the right answer. The speed of your answer and the accuracy are the two criteria which will be considered for your scores. So the speed with which you mark your answers is very important. So faster you answer, you will be having the higher scores. And once we move to the next question, you cannot attempt the last questions. And at the end of the quiz, we'll have the winners. So we'll select top 3 winners and 2 runner-ups. Top 3 winners will get the chance to participate in the next round of the quiz. So all the best to you all. And I request Shivam to share the pin so that we can start the quiz.
Shivam has already shared and 13 participants have joined. I think we can start now.
Yes. So the pin is there on the screen. So you have to enter this pin and then please enter your mobile number in place of nickname.
I love the quiz, ma'am.
Yes, I think we can start now.
Yes.
Or ma'am, I'm just looking the quiz. You can start, right?
So get set, go. All the best. So the first question is, follicle to oocyte index or FOI is calculated as oocytes retrieved upon number of mature follicles on the day of trigger, oocytes retrieved upon enteral follicle count, total M2 oocytes upon enteral follicle count, or total M2 oocytes upon number of mature follicles on the day of trigger. So you can move to the next question, Shivam. The next question is, implantation rate is calculated as the number of GSEC seen on USG upon number of transferred embryos, number of positive beta HCG upon total number of embryo transfers done, number of GSEC seen on USG upon total number of embryo transfers done. So these are the scores. So next question. A 37-year-old patient with AMH 3.5 nanogram per ml underwent IVF, but she had only 3 oocytes retrieved. She falls into which Poseidon group? Poseidon group 1, Poseidon group 2, Poseidon group 3, or Poseidon group 4? Next question. A couple has beta thalassemia trait in both the partners. Which test is required to test the embryo for beta thalassemia major? Is it PGTA, PGTA, PGTM, PGT-SR, or NICS? So the answer is PGTM. Let's see at the scores. The next question. According to the 2023 International Consensus Guideline, all are true about USG criteria for diagnosis of PCOS except follicle number per ovary more than 20 in at least one ovary, follicle number per section more than 10 in at least one ovary, ovarian volume more than 10 ml, or follicle number per ovary should not include follicles more than 7 mm in size. So which one is incorrect? The next question is, a young female with infertility has secondary amenorrhea. She did not bleed on progesterone and combined oral contraceptive pills withdrawal. So what is the diagnosis? Most probable diagnosis? Hypothalamic hypogonadism, premature ovarian failure, Asherman syndrome, or is it polycystic ovaries? Next question. Which is false about long agonist protocol for IVF? Agonist injection is started in the luteal phase of previous cycle. Duration of stimulation and doses are more as compared to the antagonist protocol. Both HCG and GnRH agonist can be used as trigger for final oocyte maturation and more risk of OHSS as compared to antagonist protocol. Next question. In which part of the sperm is mitochondria present? Head, midpiece, tail, both midpiece and tail. And here are the scores. Next question. Which test would you advise in cases of non-obstructive azoospermia? Karyotype, Y chromosome microdeletion, CFTR gene mutation, both karyotype and Y chromosome microdeletion. So we are moving to the 10th question. What are the preventive strategies for OHSS in patients with PCOS? All are true except GnRH agonist trigger, antagonist protocol, recombinant HCG trigger, freeze embryos. Next question. What is Mayer's theory of endometriosis? First option, retrograde menstruation, coelomic metaplasia, immune dysregulation, hormonal disbalance. Next question, please. Which is not correct about globozoospermia? Big size sperms, acrosome malformation, fertilization can be achieved by ICSI associated with a genetic mutation. Next question. What is false about genuine and empty follicle syndrome? Circulating HCG levels are adequate. Rescue HCG injection with second HCG bolus injection has limited role. Mostly result from incorrect HCG administration. Genetic factors are probably involved. So you have to find out the false option. And this is the scoreboard. So 14th question. What role does epigenetic reprogramming play in early embryonic development? It has no effect on gene expression. It is crucial for proper gene expression and embryonic development. It only occurs in later stages of development. It is solely determined by paternal genes. So next question. What implications does uterine microbiome diversity have on IVF outcomes? A diverse microbiome is linked to poorer outcomes. It has no effect on implantation process. A balanced microbiome may enhance the implantation success. Only the vaginal microbiome matters. Next questions, please. Question number 16. What are the potential long-term health implications for children conceived via IVF? No increased risk compared to naturally conceived children. Higher risk of metabolic disorders and imprinting-related conditions. Only benefits with no associated risk. Risk only related to maternal age. Question number 17. What does heteroplasmic mitochondrial DNA refer to? It means the absence of mitochondrial DNA, the presence of multiple mitochondrial types, DNA types within a cell, type of genetic mutation in nuclear DNA, a method of assessing the embryo. Question number 18. Zivic N2 test is used to measure the hormonal levels related to ovulation, to provide a non-invasive assessment for the presence of endometriosis, to evaluate the ovarian reserve, to determine the success rate of IVF procedures. So second last question, what is the primary purpose of the EMA and the ELIS test? To measure the hormone levels in the blood, to assess the histopathological features of the endometrial tissue, to identify the specific bacterial pathogens of the endometrium, to evaluate the ovarian function. So now we are having the last question. Which of the following lab techniques is used to select the most viable embryos for transfer? Time-lapse imaging, cryopreservation, ICSI, follicular fluid analysis. So here we have the 3 winners. So these are the top 3 winners. Congratulations to all the winners. And 4th and the 5th runner-ups, 1st and the 2nd runner-ups. Can we have the names also, Shiva, or only mobile numbers?
We only have the mobile numbers only.
Okay, okay. So we'll convey this to the concerned winners, and then these winners will get the opportunity to participate in the next upcoming rounds. So Dr. Mamta, if you want to add something, you can add.
So our first 3 winners will participate in zonal quiz, and winner of zonal quiz will go in final quiz in Fertivision, which is in Ahmedabad in December. So congratulations to all the 3 winners, and we have only mobile number. We will inform them, and thank you for participating in quiz.
Thank you so much, Shivam. Thank you so much, all the participants, for taking out your precious time. It was really wonderful to see all the participants here. And at the 443 mobile number, the last digits was really scoring high every time on the scorecard.
Yeah.
Yeah.
Thank you, everyone.
Thank you. Thank you so much.